Hi, everybody, and good day. One of your clinical instructor um, asked me to have this video presentation about my opinion and my experience on the educational system here in the US in terms of nursing. So, I am a new teacher or clinical instructor here in the US. I still new in the job, but I could impart you on how the nursing educational system here. So I was tasked to answer this one particular question regarding as a clinical instructor, how did technology help you in taking care of your patients to nursing students? So as a teacher here and as a student way back 12 years ago, I could see a big difference between how they teach way back 12 years ago and how is it right now. But since that's the Philippine setup and here is the United States setup, I could see that there is really a big difference right now in terms of where technology is involved. So here in the US, I could see that it's very systematic in terms of the system on how to, you know, to teach the students. So I summarize this one into five categories or ways in which technology is beneficial here in the United States. So we have the simulation technologies, which is a tool allowing nursing students to practice and hone their skills in a controlled environment, in which high fidelity mannequins can mimic real life scenarios, providing students with a realistic and immersive experience without any risk to actual patients. So, in short, we have this laboratory which is equipped to create an environment or a scenario where you could ask the student to act or let, for example, assess in this particular situation. So whether a mannequin which mimic a code blue on how a nursing student respond to that kind of situation. So that's what simulation technologies. The other one is virtual reality and augmented reality. So VR and AR applications offer immersive experience for nursing students. They can virtually explore different healthcare settings, practice procedures, and engage in simulations that closely resemble actual patient care situations. So, like here in the school that I am working with, we have this special laboratory which is solely dedicated to train students on how to react and how to manage if this will happen in the hospital. So that's what it is all about. It's all about computer setup, the mannequin which shows real life symptoms, and it's as a teacher you gauge how the students perform out of that kind of scenario. And the third one is the electronic health records, which teaching students to navigate and use electronic health records, which is a crucial part for modern healthcare. Here in the US, everything is computerized. From the moment you see the patient and you input all your assessment, the head to toe assessment, you basically input all those results the initial rounds that you did with the patient, if the patient heart rate, blood pressure, how's the skin condition, if the patient has a what do you call this, cranial nerve deficiencies from cranial nerve 1 to 12, and from the psych, if the patient is cooperative, confused, the glass glaucoma scale, everything should be inputted to the computer. And not only the assessment, all the medications that is prescribed to that particular patient, it's all there in the computer. So when you're giving your medication, it's really like we're exercising here patient safety, because it's already prescribed by a doctor, it's already verified by the pharmacist, and you as a nurse will demonstrate the 7 rights of drug administration. So 3 triple check, plus you ask the patient. Everything is so systematic. That's why there is just like fewer, medication error. But if you're just maximizing all this system, then you can't be wrong with drug administration. So these electronic health records will really help the nurses in the most systematic way and in the most safest way as possible. And here we also have online learning platforms to utilize for educational resources, lectures, and interactive modules. Enables students to access learning materials and at their own pace. So we have this website that is full of educational stuff, from procedures, diseases, to the most recent evidence-based practices that they could access 24/7 at their comfort and their respected homes. So that will help them to be more aware, and in terms of new learnings, and theory wise they're more exposed to those educational stuff. So we expect them to kind of like have now an idea before the actual lecture, because it's given ahead of time to have this online learning platforms activities. So they have like video presentations that is so helpful in order to gain some knowledge before the actual lecture. And we also have these mobile apps and tools, which is the same as the online learning platform, but it's in the form of a mobile app that they could access just through their phone. And we have these communication platforms. We have Moodle. Like, I think Moodle is more like applicable in terms of when you're doing master. This is kind of like a community niche where this professor and the students and the admin work hand in hand in this particular environment, and they could just upload their assignments. The teacher could use it as to have a announcement or any lessons or any activities that the students needs to accomplish. So we have this communication platform. So for a good example of this is Moodle. And of course, the research and evidence-based practice, which access to online databases, journals, and research tools enables students to stay updated on the latest healthcare research and evidence-based practices. Incorporating these resources into the curriculum encourages a culture of continuous learning. So in summary, technology has revolutionized nursing education by providing innovative tools and resources that enhance the learning experience for students. It not only prepares them for the technological aspects of their future roles, but also improves their overall clinical competence and decision making abilities. So I could say, as my personal opinion as a clinical instructor here in the US, that technology plays a vital part in terms of learning. Because I think it's not a bad idea to incorporate technology as long as it is utilized in a more productive and safest way. Um, when you are kind of like, we are 2024 now, where everything is advanced and everything should be, in sync with how the technology advanced each year. And both students and teacher could benefit with these advantages of the technology. And I hope that I impart you with some, I give you some ideas on how we do this here in the US. And to all the students here, to all the students who hear this message from me, hope you will do good with your studies. And I remember 12 years ago, I I was once a student in my life, and I know it's hard. Sometimes it's dragging, sometimes, like it really consume you. But just enjoy the process of being a student. Learn as much as you can. Don't forget to take care of yourself and enjoy, and to never give up in your dreams, because everything will make sense in the end, and you will basically savor the fruit of your labor in the end.